You're now live.
All right, thank you. Welcome everybody to this meeting of the Derby's Health and Wellbeing Board. Do we have any apologies?
Yes, we do, with apologies from Councillor Ashby, Emma Aldred, Lucy Allen, Sam Dennis, Gino Di Stefano, I think James Scott's covering, Sue Ann Lim, Stephen Posey, Mark Powell, Pervez Sadiq, Lee Sherrard and Paul Brookhouse.
Thank you. Yes, quite a few apologies today, unfortunately. I'd like to welcome, we did extend the number of councillors on this board, and I'm pleased to welcome Councillor Wright and Councillor Hazelgrave as well this afternoon. Councillor Holmes was here previously, and obviously Councillor Kerr is a stalwart, aren't you, Lucy? You've all been here for a long time and as a very good member of the board. I'm really pleased that we have Councillor Wright on the board and also Councillor Hazelgrave, because we did talk last time about wanting to have more discourse and more voices around children's health and well-being in this board, and Councillor Hazelgrave is a cabinet member for children and young people. So I'm hoping that will come through. We've got some reports around children's child poverty, etc. I think probably planned for the next meeting. So thank you and welcome to them. I do have a late item to introduce, which has been shared with you. So this is simply the quarterly return of the Better Care Fund, which is, there is now a requirement to send those returns in quarterly, I understand. And the reason I asked for it to be sent as a late item is because it might normally be a night item you might just note. But I understand that it needs to be, there's a requirement that it's signed off by the Health and Wellbeing Board or the chair in lieu of the Health and Wellbeing Board, these quarterly returns. And so rather than assume that what should happen, I thought I would send this quarterly return as a late item. So obviously if there are any comments on the content of that quarterly return, we will take them. But mainly I wanted to ask the board how we should proceed with this, whether I should just sign it off under, I mean, Gamal, I'll bring you in a moment, Gamal, if you want to say anything, but it's prepared by the council's officers, they return it, and I just sign it off, and we could have it as an item for noting on the subsequent Health and Wellbeing Board's agenda, or we can have it signed off formally by the board, presented to the board before it's submitted, although that might be quite difficult to arrange in terms of timing and logistics. So I know this may sound a little bit fussy, but I didn't want to assume how the board wanted to proceed on this matter. I wanted to ask you what you'd like to do. Gamal?
Thank you, Chair. I know there's a short report as well that came out as a late time, but very briefly to pick this up, Chair, I think it's helpful to have transparency. The issue around some of this is around timing, and colleagues from the ICB will know this better than the Council around the number of returns you have to do to NHS England on BCF and other aspects, which are joint returns. So, Chair, in terms of context a little bit, is that the actual BSF plan and the budget approved by this board won't change and remains the same. The returns tend to be around Q1 between the ICB and the local council in accordance with those budgets. What have we actually spent on those budget lines? And this return just is an expenditure return that tends to come in to kind of as a return to the NHS around our expenditure pattern in line with that budget. The recommendation mainly become a timing perspective because we're under pressure from the ICB and from our side in order to meet the deadline to do this return, which is a routine monitoring return. The recommendation, subject to this board's consideration, is to look for delegated authority for the returns that tend to come in, which are normally just expenditure monitoring returns, to be approved under delegated authority for the Strategic Director for People Services in consultation with the Chair of the Health and Wellbeing Board, which is a pattern that we used before. And Chair, in terms of the actual expenditure completion, that's done jointly between the ICB and the Council, so therefore the submission can be made. But again, as reassurance, it's not the budget that's changing, it is just an update on where are we up to on the expenditure in those categories. Thank you.
Thanks, Gamal. Yeah, Chris.
Yeah, thanks for bringing it. I think it's important to just ask the question. I think you're right, Chair, but I'd support the view of items coming to the board by exception if there is a change to the original plan. So I would, absolutely support your sign-off with appropriate officers bringing to the board if there's any change to that original submission. Thank you.
Thank you for that. So the recommendation is that it's just delegated to myself and the relevant officer, and obviously if there were any significant changes then it would be reported to the board. Does everybody happy to accept that recommendation? Okay, thank you. Sorry to be pedantically bureaucratic, but I didn't want to make any assumptions on that matter. Thank you very much. So moving quickly on, do we have any declarations of interest? No. Are we all happy to accept the minutes of the 25th of July as a true and accurate record? Councillor Holmes.
I believe I was in attendance and I'm not on the... that's all right. I was overlooked at the time, I remember. It's fun. I can just be added. Thank you.
You only momentarily overlooked Councillor Holmes. You were quickly seen at the back. Thank you. Thank you. Any other comments on that? No, thank you very much. So our first item is an update from Carriel Webster on tobacco control in Derby. Thank you, Carriel.
Thank you. So can we move on to the next slide, please?
I think you may. Can I suggest you move your laptop to the side, Carriel, so the microphone can pick you up? And thanks.
Can you hear me now? Perfect, thank you. So the purpose of us being here today was to provide an update on our tobacco control work across the system since we last provided an update on a health needs assessment that was done on tobacco control for Derby City. As one of the recommendations and commitments around that, coming out of that was around strengthening and supporting more system-wide and partnership working to optimise our tobacco control efforts. So since then, we've launched a ICS-wide tobacco control strategic board, and there's also been some developments around additional funding for local authority stop smoking services and support, which will be really beneficial for helping people locally to quit. And then just to seek endorsement of by the Health and Wellbeing Board of the East Midlands Regional Public Health Vaping Position Statement, which was previously brought as an information item back in January. Next slide, please. So for us, tobacco control is all about using a comprehensive range of measures to help reduce tobacco use and the harms it causes in our communities. And tobacco use still remains a significant threat to our population health, and so the key messages from our health needs assessment still stand. We know that smoking is the leading cause of preventable early death and ill health nationally, and in Derby around 19% of adults smoke, so that's significantly higher than the England average. We also know that the harms of tobacco use impact our whole community, so smoking is estimated to cost the city around £327 million a year. So that's through costs to the NHS and social care from smoking-related ill health, but also through lost productivity in the economy, through people who may be unable to work because of smoking-related illnesses. And we also know that the harms of smoking and smoking itself are not equal across society. So it tends to disproportionately impact those people who may be living in and experiencing deprivation, and so it becomes a key driver of health inequalities. And we also know that tobacco dependency can exacerbate and lock people into poverty. Next slide. I think this just really illustrates that we know both locally and it's a similar picture nationally that people who are already experiencing socioeconomic inequalities and health inequalities have potentially a higher prevalence of smoking compared to the general population. So, for example, those that work in routine and manual occupations, but also people with mental health conditions as well. And within the NHS, it's estimated nationally that around 1 in 4 inpatients smoke, and that stopping smoking can substantially reduce the chances of readmission. So really important there about how we can help people to stop smoking with clear benefits for our healthcare services, but also a key population that we need to reach. And for Derby, smoking in pregnancy continues to remain a priority, so around 1 in 9 pregnant women in Derby smoke compared to the national average of around 1 in 11. I think what the evidence from local needs assessment shows us both across the city and also in the county and the wider evidence more broadly is that if we're to be effective in our tobacco control efforts to reduce smoking and the harms it causes in our communities, we need a whole systems approach. So it can't be something that is successfully tackled by a single organisation or a single measure in isolation. So we need to look at approaches around preventing uptake, so preventing children and young people from taking up smoking, but also measures to help support every person who smokes to quit, and then thinking about reshaping the smoking and quitting environment through things like promoting smoke-free policies and environments, but also action to tackle the illegal tobacco trade. And we know that system working on tobacco control already aligns with a number of sort of local strategic priorities. So reducing smoking prevalence is part of the system agreed turning the curve indicators, and also aligns with the stay well elements of the integrated care strategy. But in the last 9 months locally, we've made significant progress. So there was an ICS sprint that was focused on smoking, which has really primed the whole system for action. The Integrated Place Exec has pledged support for tobacco control to be a system priority this year. And then in January, we launched a multi-agency tobacco control strategic board. And alongside that, we've also had confirmation of additional government funding, as we've mentioned earlier, for stop smoking services and support. Next slide. So our tobacco control strategic board, it's still quite early and it's still developing and evolving, but there's lots of work already underway. So we've got a function across a strategic, tactical and operational programme of work that's begun. And so the Tobacco Control Strategic Board, that will bring together senior leaders across the system and will have an oversight and assurance function and drive action. Beneath that is a tactical group, and that's the sort of engine room for driving work forwards, and will report into the Tobacco Control Strategic Board, but will also form a hub for some operational groups that are being launched in the autumn that are focused around preventing uptake, tobacco dependency and treatment, and also environments and enforcements to really sort of deliver action on our tobacco control activities. As part of the strategic board, we've also developed a system vision, ambition and roadmap. So the vision is looking at how we can make Derby and Derbyshire smoke-free by 2030. When we say smoke-free, that means a smoking prevalence of 5% or less, which aligns with the national ambitions for England to become smoke-free by 2030. And to do that, we will be looking at ambitions about how we can create a tobacco and smoke-free future for all, a healthier future for all, and a future free from the economic and social harms of smoking. Next slide. I think this just really illustrates that tobacco control is everybody's business, and that across the system, partners are coming together to deliver action around this. So the Integrated Care Board delivers the NHS Tobacco Dependency Treatment Programme, which supports acute and mental health inpatients to stop smoking, as well as people during pregnancy, and also supporting wider system work. We've got the role of local authorities in delivery of services, including stop smoking services, but also the trading standards work around tackling the illegal tobacco trade and enforcement action, and then wider work around providing comms, insight and marketing support. And then the function of the ICS together through the Tobacco Control Strategic Board and its subgroups to bring together key partners across the system and those task and finish groups that we've discussed. And the aim is that Tobacco Control Strategic Board will be that single point of leadership for action on tobacco control across the ICS footprint. Next slide. And I think a really positive development for us is this additional government grant funding for local authorities-led stop smoking services and support, which really sort of complements and aligns with our local system action. So it's a new grant from the Department of Health and Social Care that will also help to contribute towards those national smoke-free ambitions, which aims to help more people to quit smoking and increase the numbers of people accessing effective stop smoking services and support and interventions through increasing funding available for local authority-led stop smoking services and support. Funding is for 5 years and it commenced in April this year, and the Derby allocation is around £375,000. Next slide. So, in line with the grant guidance and conditions, locally we will be using that funding to help build demand for local stop smoking services and support through things like communications, marketing and promotion of services, so people know where to access support and that we have communications that reach people in the right way and at the right time, but also around improving referral pathways, and then also making sure that we're building capacity for our local stop smoking services and support through things like enhancing leadership, coordination and commissioning capacity, additional specialist staff to be able to deliver stop smoking support and interventions, improving knowledge and skills of non-specialist staff to extend the reach of our stop smoking interventions, so things like frontline staff being trained to deliver very brief advice around smoking, because we know that that's really effective for supporting people to access services, and also increasing the spend of stop smoking treatments, so things like nicotine replacement therapy. Next slide. And lastly, I just wanted to bring us on to the East Midlands Regional Vaping Commission statement, position statement that I think was previously brought to board back in January. So this is something that's been developed by the East Midlands Tobacco Control Community of Improvement, and that's a network of professionals across the East Midlands, including local authority-led, local authority public health teams, which aims to reduce smoking prevalence through regional collaboration. And the reason that the position statement was developed was because it was recognising that there was a rapidly developing evidence-based policy environment and public interest and debate around vaping. So the position statement brings together the latest evidence and information to be able to provide clarity on the public health consensus around vaping across the region, and it outlines the key evidence-based messages on vaping. Next slide, please. And so endorsement of that statement by the Health and Wellbeing Board and its partners would be really welcomed, because it would support our local action on tobacco control and reducing smoking prevalence through supporting a consensus across stakeholders in Derby on the position on vaping, around system partners in the development of their own policies and practice, but also in making sure that we can provide a clear, consistent and unified communications and messaging and information around vaping for the public. I think just in bringing us to a close, I think there's probably a consideration for us locally around some of the opportunities for us in being able to really drive forwards our tobacco control work, and thinking about how can we support system partners and providers to work together to achieve that vision of making Derby and Derbyshire smoke-free by 2030, and what are the best ways that we can secure partner commitments to do that. Thank you.
Thank you, Cariel. So yes, this is something that has been addressed at the ICP, isn't it? And in many other boards. So I suppose the key ask today is about support, isn't it? And encouraging more people to stop smoking, etc. So bearing that in mind, do we have any comments, please, or questions? Councillor Hazelgrave first.
Just from the children and young people's perspective, it was mentioned earlier on prevention of uptake, but then there's not a lot of said later on in terms of the strategy to make sure that our young people make an informed choice not to smoke. And I think that's, bearing in mind that there is a new law coming in that I think anyone under 18 is unable to buy cigarettes. It's also the issue about vaping as well, isn't it, among our young people, and making sure there's some kind of work with schools maybe delivered by teachers after some careful training and advice about that. But I do think that would be really important so that the next generation, we're not having to worry so much about smoking cessation because they haven't started in the first place.
Thank you, Councillor Heathergrove. There has been a project working with schools around vaping, but I'll let, so that is a very good point. Yeah, you're right to focus on that specific point. Bearing in mind what I was saying earlier on, we do need to look at the children's perspective more, young people. So, Carrie-Elle, did you want to?
I think it is a really important point. It's about supporting schools and young people and also parents and carers to have that information around smoking and vaping to support young people to make a healthy choice for them around not uptaking smoking or vaping. And I think there is, through the Tobacco Control Strategic Board and the operational groups being set up, a group focused on prevention, which aims to bring system partners together around that to look at ways in which we can deliver action to help support prevention around children and young people collectively across the system and what needs to be done there to have the impact and benefits that we need.
Thank you, Carrie. Just before I bring you in, Kathy, and actually I had Councillor Kerr next, actually, and then I'll... thank you. We've had a project though, haven't we, Robin? Was it a year or two ago, specifically focused on vaping in schools? Because I think my understanding is, from the young people I know, some of whom remain nameless, that it's more vaping than smoking these days.
There has been some work done with schools specifically on the vaping, which head teachers raised with us as a particular concern. I think the issue is that this is always ongoing work, isn't it? So we want to continue with that work, but we also don't want to lose the message that we also don't want children and young people to start smoking as well. So it's making sure that all of those messages, and I think the position statement is helpful in that it's framing the role of vaping. It is what we want to do is people who can't quit smoking to take up vaping because it is less harmful for them to do that, but reinforce that message that we don't want people who don't smoke, particularly children and young people, to vape.
Thank you. So it's Councillor Kerr.
I'm absolutely amazed by the figure in here. I think you said £327 million a year is the cost just in Derby. That's £1/3 of £1 billion to the private and public sector. And you know, that is, I think, should be the motivator for not just the integrated care system, but much wider, to say we should be spending that money better. So I'm asking whether or not we've engaged the business sector within this messaging. And if not, whether we can do some work, if it's not already been done nationally, to identify how many lost hours there are as people go out and have some fresh air, or what it costs to sweep up the litter from these activities around the entrance to a business place. Because these will all have costs to them, and they are falling on the business sector. So we ought to be talking to, I don't know, the East Midlands Chamber or whatever the groups are that the council will already be engaged with, but we ought to be talking to them about this and then providing with the resources, the links through to how you can get support, maybe the training for some of their key people, maybe a screensaver to put on their laptops so that people are getting the message at that level from a different direction, because we'll have the evidence to say it's actually costing you this as well. And we need to be, if we're going to hit that 2030 target, we need to go wider than just the integrated care system. My other point is about the vaping statement. Vaping is changing so quickly, the information and the recommendations and so on that. And, you know, the new government is being a bit more bullish about that, I think, as well, which in my view is good. And I'm just wondering, the statement that we're asked to endorse is November 23, which probably means it was prepared about a year ago. Is it still up to date? Do we need to qualify our endorsement of it to say that, you know, effectively until the next one comes along?
Did you want to come back, Carrie-Elle, on those points?
I think taking the first point around the business sector. I think that's a really important point.
It's
Sorry, it's me. It's my fault.
Streamed. I don't know how many people are actually watching, but they won't pick up anything at all. Even if people in the room can hear you, they won't pick up anything unless you can access it on the microphone. So.
Apologise. Thank you. I think just to pick up on the first point around the business sector, I think that's a really important point, and I think it's probably something for us to feed back into the Tobacco Control Strategic Board about how we link in more effectively around that. So if there are any pre-existing council networks that we can use as a starting point there, I think that would be really beneficial. I think the second point around the vaping position statement is that the most sort of comprehensive evidence that we have around that was an evidence review that was done in 2022 by the Office of Health Improvement and Disparities, and that statement brings in the evidence base from that. So I think whilst the vaping environment is continuing to evolve and change, that statement is based on the evidence there, so I would suggest that it does continue to be valid, particularly the key principles in there.
Thank you, Cariel. So Cathy.
Thank you very much. I mean, this is clearly a hugely important topic, and I'd just first of all like to endorse what Councillor Hazelgrove said about children, because I think there's something about, if we're going to achieve this, having more come into the pipeline that we then have to stop smoking is not a good thing, so we need to turn off the tap. But the point I was going to make is my worry really around this is we're clearly a significant outlier on this. We've got a higher number overall, but that hides, not actually hidden because we've got it in the figures here, but we can see that there are groups where that average figure is only average, and there are groups where it's far higher, and these are linked, it seems, to, as we know, it usually is linked to conditions of living and all sorts of things like that. And here we are with a number of 19.3%. Round or 2022, we're aiming for less than 5% in 2030. The gap seems enormous, and the time, I'm just wondering about, have we got sufficient? What happened in the last 5 years? How far down did it come in the last 5 years? Because we've really only got 5 years now in which to do this. So, and I'm also wondering how much of the effort is going into the underlying causes of why people smoke, because there's clearly differences from different groups. So hugely supportive, but I'm just a caution on, I admire the ambition, but I'm not sure that what we've got in place is sufficient to realistically get there.
Yeah, just a minute, Cecile. I tend to be sympathised with that point, actually. Did you want to come back to that, Cariel?
I think both locally and nationally, we recognise that 5% target is ambitious, but I think it highlights the importance for all of us in coming together as a system, and also for action nationally to drive forward work on tobacco control and reducing smoking prevalence. I think in terms of some of the work that we're sort of doing locally, particularly with the Stop Smoking grant funding, there is some focus around doing some community insights and engagement work, so we can really understand the lived experience of people who smoke and what they need from services and what they need from messaging to be able to support them to access the support that they need to quit.
I think that's really important, Cariel, because we've had this recent Move More Derby initiative, haven't we, where we're not, instead of just saying to people you ought to move more, we're actually saying, well, what, talking to them about why they don't move or what would make them move more. And I think that's exactly the place to start, because my own personal view is that the messaging about, I don't see how anybody could have failed to miss the messaging about smoking now. So, if they're choosing to continue to smoke or they feel compelled to, then it's probably important to address that rather than the messaging, because most people will have got that. So I think that's exciting. Thank you. Councillor Wright.
Thank you, Chair. My points are linked to points that have just been expressed by yourself. From the information you presented, there is a link between tobacco smoking in particular and poverty and inequality. do you have information which also show the link between prevalence of smokers and sex, for example? And given that there is a link between poverty and smoking, is poverty the underlying and inequality the underlying factor that should be considered? And to what extent is your messaging and your prevention strategy taking account of if there are sex discrepancy differences and the issue of inequality? To what extent are these factors included in your prevention programme or programmes? Thank you.
Yeah, thanks, Cecilia. I think that's a really excellent question, actually, because we often don't have, and there's no criticism of anybody, but often we don't have that kind of figures divided by sex or gender. So, Carol, can you say something on that?
So I think at a national level, there is some data that still recognise that smoking prevalence tends to be higher in men compared to women. But as you've said, I think at a local level, unfortunately, we don't get data that's broken down by sex or gender. And we recognise that there are gaps in the data that we do have available to us. So some of that insights work, again, will be really helpful there. And I think it is really important that through our work in trying to support people to stop smoking, that there is that focus on inequalities through that, and understanding those groups that are potentially disproportionately impacted by smoking and its related harms, and whether they need additional support or maybe more targeted and tailored messaging or services to support them through that, to access the help that they need to quit and to stay smoke-free.
Thank you, Cariel. I mean, I think that is a really important point, and I'm sure we'll keep focused on that point, because we do have a constant theme running throughout the board and the work of the public health team on health inequalities, and it is something that we are aware of on the smoking front as well, aren't you, Cariel? Chris?
Yeah, thanks, Chair, and thanks for the paper. I thought it was really important. A couple of observations and another question. In terms of the vaping statement, I thought it was really helpful to see. We have debated it before, and I think this is a really helpful place with really simple messages. So I would certainly endorse it. Out of interest more, but thinking ahead, I wonder if colleagues could ask the East Midlands group about what the position statement may be in a few years' time on stopping vaping, and what the position statement may be on that once, people have transferred, what the future position statement may be on that. But I recognise that's not a now issue. In terms of my main challenge is, this is enormous, it's complex, and there are lots of people looking at it. So we've got the Integrated Care Partnership and we've got 2 health and wellbeing boards. I really support Councillor Kerr's question around the wider determinants, the broader partnerships. So just some thoughts about how do we put this into the anchor work stream, because Andy and colleagues are working hard on creating a framework, and one of our key areas there is the health and wellbeing of our people who work for the different industries out there, whether public or private sector. So that could fit nicely into there. We've got to make sure that we've got alignment with Derbyshire, because many of us are D2 organisations, so that feels important. And then just thinking about where colleagues were going then around the causes of the causes, and that just really homed in what the importance of Health and Wellbeing Board and the GSNA is in terms of the work the ICP does on getting on with some of these prevention approaches, but actually getting underneath why people smoke in the first place. That feels very much a Health and Wellbeing Board and GSNA flavour and topic. So I hope that's helpful. There are more observations than anything, but thank you for the report. Thank you.
Thank you, Chris. I've got Amjad next.
Thank you. Mine's just a comment that the sector, voluntary sector, welcomes this piece of work, and we're happy to be involved in, especially from a Derby Health Inequalities Partnership, because we recognise that there's a major gap in data, especially when it comes to ethnicity. And again, unfortunately, some of our more deprived wards are highly populated by our diverse communities. So from a community insight perspective, there's definitely an offer there that want to be involved in. And we also know some of the insight that we have from previous consultations, that there's a lot of the inequalities we see is due to the barriers that our communities face in accessing support services and smoking cessation. So again, happy to work with yourselves and help and co-produce a service that can be fair and equitable to all.
Oh, thank you for that offer, Amjad. That's really helpful, and again highlighting another very important issue in relation to this and health generally. I'm just thinking I need to start drawing this to a close, but I feel that in a way we've just scratched the surface, because given the significance of this issue and the amount of investment that's already going into it, and we have to recognise we are getting more investment, and the current government, as everybody in the room probably knows, I have slightly maverick views on some of this, but I keep them private. I don't share them. I go with the public health advice, and so the current government is very much giving health professionals the support I think they'd like. So I think that will be a boost, Kathy, potentially, in terms of trying to reach the target. But I really agree with you. There's a lot more that can be done. So before I'm going to just, so there's 2 points I'm going to address. There's 2.3 on the recommendations, Cariel. So taking that one first, commit to supporting work to encourage more people in Derby to stop smoking. We've had some really good suggestions, and we've had some thoughts, and we've had a few ideas. Is there anything more that you might have been hoping for from the room today? Just to put you on the spot, and again, you'll have to move your laptop if that's right, they won't be able to hear you. Thanks.
I think the conversations today have been really helpful and really supportive. I think would welcome opportunities to link with Amjad and the Derby Health Inequalities Partnership. I think just if there are any opportunities for partners in their organisations to become involved in the Tobacco Control Strategic Board operational groups, that would be really beneficial, because their insights and knowledge and expertise are going to be really helpful for shaping our tobacco control work and driving that forwards through those groups and the wider work of the board.
So there's an offer that people can just put themselves forward to join that board? Yeah.
I don't know the best approach of doing that, but I can share the contact details, because we're working jointly with the county on this, of the person at the county who's coordinating those groups. So if people would like to put themselves forward to participate, then it would be really helpful, and we can perhaps share that information with that colleague.
Okay, so if, there's an encouragement here to get involved. So if people are willing and able, should they contact you, or how will that work? How will they?
Yeah, that's absolutely fine. They can contact me, and then I can share those details with the colleague at county who's coordinating the groups. That probably seems like the simplest approach, doesn't it?
All right, thank you, Cariel. So that is really important. It's important for people to get on board, get involved, and help as much as they can. Thank you. So the next one is 2.4. So we need to collectively endorse the public health vaping statement. I am happy to very quickly take any comment. I know we've had a few comments. I'll take any quick further comments there are. The only comment I would make, Cariel, is, I mean, I suppose I'm happy personally to endorse it. I just, in my usual manner, have read it, and there were one or two words I wasn't totally happy with, but I've reduced it just to one. So, and I guess there's no option of slightly amending this, I guess, is there? But there is no option. No.
I think because it's been regionally produced and agreed, I think we'd struggle to amend.
Okay, well, we have to take it as it is then, but very quickly then, on page 1, bullet point 2 at the end, under key messages, it does say that the number of people smoke a known uniquely lethal product, and I thought that was quite a claim, really, to have in there, given that, I don't know, ask the average parent, would you like your child to smoke or would you like them to be a heroin addict? You know, they might go for the former, I don't know. I mean, I'm not suggesting they'd want to go for either, but I just thought that was not a particularly, I thought that was an odd claim, but if it's, go on, Chris, you want to justify it, go on then.
No, I think it's more, I mean, colleagues will tell me, just to help if I may, Chair, I think it's the fact that it's, that tobacco has no health benefits. So it is uniquely harmful. I'm not making any claim as to any other substance, but I think that was the emphasis behind it. So I think it is technically true, and I would certainly endorse how it's written. But I hope that's helpful. Thank you.
Okay, I could challenge that, but for the sake of everybody's patience and sanity, I won't. And I'll leave it because it's irrelevant, because we have to endorse it or not endorse the whole thing. But I think that is not, anyway, I won't challenge it. I take the point, Chris. I mean, I think we get what it's driving at. It's very bad for your health. I mean, we get that, basically. Any more quick comments on this? And is the board happy to endorse that statement on vaping and its key messages? Do I take that sort of silent nods as general? Anybody not happy to endorse it? Happy to have unique opinions in this room? Don't feel the pressure of groupthink? Okay, right, we will therefore formally endorse that statement, Carrie Allen, thank you for that, and thank you very much for that report. And obviously we'll want you to come back, and if there's anything more you think people can help you with, don't hesitate to come back either via me or back to the board. Thank you very much for that. Right, we'll move on then to, so this is a project which I've been quite closely involved with myself, about supporting carers. It's being driven by the City Council, but it's been one of my key priorities as a Cabinet member. So we have a report on improved support to carers and co-production, seeking board and system partner commitment, and we have Gamal Nizza and Michael Rose who are going to present. Thank you.
Thank you, Chair. Just a little bit of context. Chair, as you've said, I know you're championing, rightly so, on behalf of carers, which is wonderful. And Chair, this report is setting out, and it's a plea really for Health and Wellbeing Board to consider and support that direction of travel, and in addition to provide leadership support, nomination, who will work jointly with the Council and the wider system around co-production, supporting carers across the system, Chair. Context in the report set out, I'll draw out key points, or in the sense of seeking Health and Wellbeing Board to commit to working with all of us as partners to implement the Carers Action Plan that's outlined within the report following the first engagement meeting we had earlier this year. The detail is in the report around 4.1 headlines around a carer is a person of any age who provides unpaid care and support to an adult, family member, friend or neighbour. We all recognise as a system carers do invaluable work for the people they care for in our communities and in wider society as a whole, and of course this can have impact on the carer themselves directly in terms of their needs as a result of responsibilities. 4.3 is interesting in the sense that I'm sure there's probably more up-to-date data. There were 22,270 carers in Derby at the time of the 2021 census who were supporting supporting customers and families, which is of course a significant number. And of course carers are important to the wider system as a whole in terms of the valuable work they do in support and avoiding pressures across the system as a whole. We've had messages and events, of course, around kind of getting that engagement and co-production working. There are actions that are ongoing as well. And at the table table 1 on page 3 sets out some of the kind of key action areas developed as a result of the event that was held. And that was a joint event by all partners, listening to carers on 25th of January, and then a follow-up event is being planned for October. But of course, as a system, it's very important for us to have listened, drawn together the action plan, and therefore have that engagement in October around what it is we are doing as a system in taking this forward. So, Chair, in summary, in terms of the recommendations here are 2.1 in terms of to agree a commitment for partnership approaches across the wider system, and 2.2 more specifically is we could do with some champions or leaders in the partnership organisation who will champion this and support taking forward some of the action areas in the action plan across key partners in the system, and it's really perhaps names, nominations of key individuals at a senior level in organisations who could champion this and work with the council on this action plan and kind of almost stand shoulder to shoulder in the next event in order to show the distance travelled. And Chair, just by way of example, this is a model that the system is familiar with when we talk about special needs co-production, and certainly health and ourselves are experienced in that field, but I think we are certainly struggling, I guess to say, to get that partnership buy-in at a senior level, to get some traction and some resource to support the planning and development. Happy to pause there and take any questions.
Thanks, Gamal. And can I just add that obviously I've said that this is a priority of mine in Derby as a cabinet member for health and adult care. And we just to, as Gamal says, we've had engagement sessions with carers. We have some funding from the Accelerated Reform Fund. I think it's good. Yeah, some nods over there. To run very specific projects around engaging carers. One of them is related to particular groups that are particularly missing from the system, and all that's in place. But generally, for the whole health and social care system, we know that, well, we all care. There's hardly anyone in this room who doesn't care or hasn't cared for someone in some capacity or other, or will do quite soon. I noticed that there's an age thing, and most people are over 50. I'm not commenting on the age range in the room, but there you go. Caring is kind of fairly universal, I think. But obviously, some people have intense demands, and obviously throughout your life, people will, the demands on oneself as a carer will increase or abate, depending, but it's within our system, and I think that's right. Personally, I think it's right. We should be a caring society. We should care for one another. We should do what we can for our nearest and dearest, and but also we know that we've got a system in place to try and support people where we can, and that actually most carers need more support in their roles, particularly the ones who are intensively well, basically essentially full-time carers for their loved one or family member. So I think this is extremely important for the whole system, really, because without good care, that then basically the demands on the system would be greater. But also imagine what kind of a society we would be if we abandoned all care for our loved ones to an abstract system, or or people weren't cared for by the system when those demands become too much or impossible for the family and friends, etc., to meet. So I think you've got very, so we have here, so I'll shut up actually, but sorry, this is something that I think is, it's just something that we have needed to act on, and we are acting on, but we need your help we need the help, as Gamal has said. So, first of all, do we have any any comments or questions on this? Well, I'm going to take Margaret first, if that's right, because I am going to confess that, Margaret, I apologise, I missed you off the last list of questions.
No problem. So a couple of thoughts, really. The first is, as I understand it, the items in blue on the appendix are the ones where we don't have anyone to lead or coordinate. And some of those struck me as incredibly important. And therefore, the more pace we can put into getting people identified as leaders to coordinate. And the second thought I have, and this is not a Derby experience, but it's a personal experience, is there are quite a lot of people employed to signpost you to things. But then when you follow the signposted lead, there really isn't the resource actually to help. And I think that's a wider concern, isn't it? Because if social services just aren't resourced to be able to help, then they can't, however well you're signpost. But I think the thing we could do fairly quickly as a Health and Wellbeing Board is make sure all those items in blue become black very quickly by having someone identified and willing to put things together.
Thank you, Margaret, and I totally agree. So I'm just going to come to the other questions in 1 second, but I don't actually have, I just have a print off here, so I don't have any colour. So I do have, I'm not sure, are we going to try and, oh, you've got, thank you, Michael. Do we need to, are we going to try and fill some of the, I know in 2.2 we've got specific requests. Are we looking for filling in those requests today, Gamal, with specific names or specific answers?
No, Chair, what we were looking at really was the suggestion for nominated leads to work with us to develop those areas in blue, and for Health and Wellbeing Board to endorse kind of taking this forward in relation to that.
So in a moment then we might be asking for names of nominated leads from different organisations to work with yourself.
That's
with
right,
Michael.
Chair, that would be helpful.
Okay then, right, before we come to that then, thanks. I can't remember who was next actually. Was it, I'll go for Paul first then, Councillor Hazelgrave.
It's pleasing to note that on table 1, the item 4, review pathways for young carers, etc., is something I did seek assurance about what the arrangements were when I came into post. I've only been in post about 6 weeks, I think. It seems shorter than that, but it might be a bit longer. I was pleased to hear it. I would be interested in, though, finding out, there is an offer there, but what's the uptake? And it could be that young people are the only other person in the household besides the person they're caring for, that they are kind of diffident about taking the time, but I think it's really important that they do, because as we know, that mental health issues among our young people are prevalent. And I'm a Guardian reader, and the other day it was telling me that
surely
in any
not,
class,
Paul, surely not.
In any class, I'm talking about in secondary school, any secondary school, so 11 to 16 to 18, a third of the young people in any class are likely to have, may have mental health issues. And of that third, 1/3 of them probably do, and 2/3 possibly do. Now, they're all probably and possibly, but it's saying that, and that's an average. In some classes, of a class of 30, we're going to get about 9 people that could have those issues. And if they're a carer as well, and they're a unique carer in the household, that could add further issues, because the key to it, isn't it, and the therapeutic thing is meeting their fellow peers in a safe space and having positive interactions with them, and particularly when they have that pressure of being a carer 24 hours a day in the household. So I would like to, I'd like some reassurance now that whatever the offer is, how well is it uptaken, and if there is a kind of lower uptake than we would like, is there any way we could bolster uptake by the kind of offer that we're offering?
Thank you, Councillor Hazelgrave. So, Michael, would you like to come back on that, or Gamal? Is that something you can respond to now, Michael?
There we go. Yes, I think there is a lot more work to do. I think the key thing at the moment is actually identifying and recognising where there is a young carer in the household. And that's where we talked about sort of the number one priority is the idea around think carer. It's recognising that that individual, that young person, or perhaps the family are not going to recognise or identify them as being a carer. So it is actually really beholden on the authorities, any contact that we're having, whether that's through GPs, adult social workers, anything like that, where perhaps the young person isn't in and of themselves particularly isn't known, that we do. And that's something we need to do a lot more work on. We know that it's hard enough. We know that there's an extended period before adults will identify and recognise themselves as being a carer. I think Carers UK talk about 2.5 years from them starting a caring role to them identifying. So that's really challenging. And that's when somebody perhaps has that understanding, and perhaps you might expect them to be able to. So expecting a younger person to be able to do that and recognise it when perhaps it's pretty much been the only thing they ever known. So yes, there's a lot more work to do there. There obviously are services within Children's. We're working increasingly closely with Children's on their carer support programme, and also how those carers then move through into getting the support as they turn 18 and become adults. We're not there, but absolutely that's one of those things we really need to do.
Thank you, Councillor Hazelgrave. Thank you, Michael. Just quick, so perhaps something you could also keep on the horizon in your cabinet role, Paul, please, and feed in. Thanks. So I've got some hands. I've got Councillor Kerr next, and then.
Thank you. One of the items that's been raised and noted in the event that was held for carers that doesn't follow through onto the action plan is training. And I think it would be really good to have training on that list. And I think there's two reasons. One is because a carer who feels more competent in their role may well be able to continue to be a carer for longer before they need to pull in professional support. But also that somebody who is going out and being trained, potentially through, I'd hope, a partner like Derby College or maybe the Adult Learning Service, will also be meeting peers, other people who are in caring, and that in itself can be a supportive opportunity. So I think the sort of issues about the mental health can help to be addressed by that, as well as the needs for the individual being cared for. The other side on that is that some of these people who are carers, once their caring is no longer their full-time occupation, for whatever reason, they may be looking for a career. And if they've done some training, maybe as far as an NVQ 1 or 2, depending on what their training has been, it will give them an opportunity into the workforce in an area where we know that there will be jobs available. And that in itself may be of help as well. So I would hope we can add that to an action list and get Derby College and the Adult Learning Service to be owning it. And if we have those courses then available, then young people, for example, or others looking at training opportunities will see them available and may more earlier recognise themselves as carers as well. So I just think that's a possibility to explore. My second point is also something that's not on the list, but I think may have been alluded to in the discussion, which is about transport. There are a lot of people who may not have a car, may not have access to a car. The cost of taxis is quite high. There's talk about taxis and training of taxi drivers. But we're not talking here about buses, and buses are now accessible, much more accessible than they used to be. But the person who is a carer may be paying for their fare. At the moment, it's only £2 there, £2 back, but that's unusual, and I don't think that's going to last. But is there an opportunity here to look at the potential for a carer's card, travel card, so that they could go half price or something else that we could talk to the bus companies about, that we could initiate happening, and make that some way of enabling a better quality of life for some of the people, some of the carers who may not have that opportunity, and for those they're caring for who are more likely to have a free bus pass anyway.
Thank you, Councillor Kerr. I mean, there's interesting suggestions there. I know that Disability Direct have a carers card scheme where there's not specifically a travel scheme, I don't think, but where you can, for a very small fee, you can have the card, and that gives you access. First of all, it nominates you as a carer, it designates you, sorry, as a carer, and gives you that status. Say, for example, like in COVID during the pandemic, you know, many carers didn't sort of access the kind of support that NHS staff quite rightly had, because there wasn't an easy way of designating them as carers. So they have that scheme. It's a recognition scheme, it's a status scheme, and it does give them, lots of businesses buy into it, and they can have reductions in various businesses. So there is that already being run in the city by Disability Direct. So it might be a question of working with them a bit more closely. But Michael, very quickly, have you got any comments that you want to say in response to Councillor Kerr's suggestion?
I think the training is actually it's a really good issue. It is pertinent. I'm not going to pretend that the action plan picks up everything that was mentioned. I think we've kind of prioritised some things, but it is certainly something, both in terms of people's caring role and, as you say, moving forwards, in terms of where they go next. There are groups that meet for people who are perhaps were carers, and then either their loved ones are either now being in full-time care, for example, in residential, or they've passed on, and so there are groups around that. But actually that idea that part of that moving on into something else, and what that something else is, and giving them the support, practical support as well as emotional support to do that, I certainly think that's something worth us looking at, and we can talk to, certainly starting with the Adult Learning Service and others, we can talk about that. So yeah.
Thank you. So I've got Councillor Wright.
Thanks, Chair. I'm just really wanting clarity on 2 or 3 issues. The document about carers, is it predicated on the Caring Act 2014? The reason I ask that is because in the document it does indicate that carers tend to be over the age of 50. So I'm assuming that in talking about caring, we're not talking about parents caring for children. That doesn't figure in this. Just asking that question. I'm just saying. And in terms, I've got two other points. I do think, I know it would appear inaccessible, but I do think we ought to try as much as possible to get as much data as possible on young people, particularly school age, that are involved in caring. I do know it's difficult, but I think the point's already been made that you might be able to garner the statistics indirectly through other agencies, the medical, whatever. And then thirdly, I can't remember the statistics, but I know that carers, and it would be worthwhile to get some figures on the cost, the invisible cost of being a carer. And I do know that the economy relies on carers doing unpaid caring, that adds a substantial amount to the economy. And I'll try and get the statistics. I remember reading about this some years ago. Thank you. Just those observations.
Okay, thank you, Councillor Wright. I will let Michael go. I don't think we're not predominantly talking about people who are caring for their own children, except to the extent that they're caring for children with learning disabilities, I think. That's my understanding. Of course, you're right. I mean, I'm saying that everybody cares, and when I say that, I'm talking very generically, but I think there is a flux and a flow, if you like, between different roles, and I'm just saying that's a normal part of life. It's just when it gets very intense that we have to offer more support for people. But Michael, do you want to come back on some of those?
Yeah, I mean, we are talking about where it's children with physical or learning disabilities. Then we're not talking about parental carers, but we are talking about children who do care for potentially other children or for adults. So they would definitely be included. Data, yeah. Any ideas? Very, very welcome. We did meet. We went to the Place Partnership Board on Tuesday and had a very good discussion there, and we're hoping that certainly out of that we've made some links with around some of the data, around some of the shared care record and around some of the GPs as well. So we're hoping we might be able to do some work there, but it has proven, much like it does with carers in general, and we recognise our data on all carers is not fantastic, other than we know we're not getting anywhere near the real number. So we need to do better there. And again, we're hoping linking up with the GPs particularly, and that encouragement for people to register as carers with the GPs and some of the benefits that they accrue from that, to do that. I think in terms of that cost, the cost of caring, there is a figure again from last year that Carers UK put out, which was they were putting around about the same amount as the cost of the NHS. That's basically the value. It's like a whole other NHS. I mean, having not, whether you agree with the exact number figure or not, what it does is it puts it in the multi-billions, up to hundreds of billions of pounds, which shows you the sheer value and the dependency that as a society we have on carers, which obviously is the importance we associate. Thank you.
Okay, thank you. I've got James next. James Joyce.
Yeah, mine was, whether I'm off the mark or not, but I was interested in 4.3, Gamal, where you said about 22,270 carers in Derby, and albeit that's older data. My question is, do we know how many of those carers are actually our colleagues and members of staff within the organisation? And what can we do in-house to help those people, first of all, as a first starting point?
Thank you, Chair. It's a very good point. And no, we don't know that. And we do need to get into the data analysis to understand that. And Chair, the plea from, it's been a really good, healthy discussion. And we can see how broad the discussion is becoming, and rightly so. Hence, it is very important to have some system collective development and support on this in order so that we can have a strategy, principle and action plan that's robust and is integrated and connected. Hence my point around how ourselves, colleagues from the ICB and other system partners actually begin to work on this with us jointly.
Thanks, Gamal. I'm going to come to a few names in a minute. I'm just going to take two more comments because hands have gone up, and then I will, don't worry, I will be asking for names. So thank you, Chris.
Yeah, thank you. I welcome the report, however unbought. It feels like it's in the wrong place. So it feels to me this is absolutely pertinent for the Integrated Care Partnership, and I'd like to know and be assured on how this approach fits with the Integrated Care Strategy. I say that not to be obstructive, but to make sure that we've got alignment across Derby and Derbyshire, to make sure that it's a priority within that strategy because of the collective challenge we have around resource and the need to prioritise. So I welcome the conversation, but I do wonder whether we're having it in the right forum. And my advice would be it probably needs to go there if it hasn't. It was helpful to hear Michael talk about the place executive, so that gives me some confidence that broader conversations are having, but I think it ought to be there if it hasn't been already. Thank you, Chair. Back to you.
Thank you, Chris. I think that's a fair point. The only thing I can say is that this is a project pretty much specific to Derby at the moment, being led by Derby City Council with our AIF funds. And so I'm not, I mean, there is, obviously it's a system-wide issue, I agree. And we just have people in the room, it's local, we know who we are. But I take the broader point, but I think this is something that we're driving within Derby. Did you want to comment on that, Robin, at all? Or,
Yeah,
no, Gamal does. Gamal
yeah,
wants to
thank you, Chair. Chris makes a good point. I'm very happy to take this report into Integrated Care Partnership to make sure it's connected up. And Chair, if I'm being honest, in relation, some of that is that connectivity we absolutely need to do. And the other aspect is around we are wanting to co-produce, we're wanting to engage with carers, and we need to kind of endorse and support, and we have challenges on resources, but we somehow need to get it to a place it should be, and how we as a system can support and get some leadership buy-in. But very happy to take that into Integration Care Partnership to seek their views as the discussions that are happened under place. If I just bring Michael in, are you waiting to come in?
It was just really about the system-wide. We have connected well, and the Accelerated Reform Fund itself is actually jointly between us and the county, so it is a system fund. So one of the projects we're leading on, one of them they're leading on, and then there's the role of hospital, of carers in the hospital discharge process, which is a particular priority for us, which is very much being done jointly between ourselves and also with the Universal Service for Carers and Derbyshire Carers Association. So we are, I think, position-wise, we are aligned with the county. We're very close. We haven't got commitment from the County Council at the moment formally in terms of that. We've been focusing very much on how we actually start to build that partnership within the city. We've sort of done the work, tried to do the work where it's been focused, where we've been able to, between ourselves and the carers service. So obviously quite a lot of that has meant quite a bit of internal work and around reshaping that service as well, so it's a bit more fit for purpose. But it's that recognition that as we start to do that work around communication, around carers identification, around making sure that people are getting the right support and we understand what support they have, that we try to do that in a partnership way. And obviously we were doing that within the city, but you know, I don't think there would be certainly any opposition, and there'd probably be quite a bit of support from county council colleagues, particularly if we were to take that at a full system level, and I think they'd be pretty on board. But obviously if we're able to get ourselves together in the city and make that commitment, it provides a little bit more power to our elbow in terms of the cross-system piece as well.
Yeah, thanks for that clarification, Michael. And you're absolutely right, and you're right to point that out, Chris. I kind of lose the perspective that the ARF is actually a Derby and Derbyshire thing. And the reason I do that is partly because for me this is a bit micro level. You know, it really, and I think that one element has to be micro level. So actually engaging with this group of carers here and listening to what they are actually saying. You know, and that's what so that's my current focus in Derby. But you're right. That it is right across the system, and you're correct to point that out, and Michael has just clarified the position, so thank you. So my last speaker on this is, and I can't remember your name, I apologise, but please enlighten us, thanks.
Thank you, Clive Stamble from Derbyshire Rescue Service. Thank you, Chair. This is a bit of a selfish one, if I'm quite honest with you. And I don't think we haven't really got any sort of contacts with yourself, and I don't think we really sort of refer to yourself very often with it. So we do a lot of work with the Safeguarding Adults Board and so on. Reading some of the statistics, it does fill me with dread, if I'm quite honest with you. We think, after about 20 years of gaining data, we think we've got about 15% of all houses in Derbyshire without any smoke alarms at all, which equates to about 70,000. So in Derby, we think is about 20,000, just under 20,000 homes. Now, extrapolating that into the almost 22,500 carers, if that equates to that as well, we've got, and by caring, again, I'm being very presumptuous that if somebody's being cared for, there's possibly issues around mobility and egress from any sort of fire. So we've probably got about 3,000 to 4,000 homes just in Derby that's with no smoke detection and people with some sort of issue to stop them exiting from a fire, which clearly fills me with dread. So it's a very selfish ask, if we could work together to one of the hardest to reach groups we've got are people in single private dwellings that we've got no legal jurisdiction over whatsoever, and actually getting to them and trying to get fire prevention education to them as well. We launched last year, we tragically lost 2 people in house fires in the west of the county. That's in very similar circumstances. We're under, if you like, an informal care routine. One was in Matlock and one was in Buxton, and so this is sort of particular relevance to it, really. What we try to do, we try to launch things called 15 minutes to save a life. So rather than trying to target the people who lived in the houses, try to target the people who went and cared for them, or nipped in from the gym at the end, or nipped in from work. So if we could work together on that to try and fill the gap, if you like, for the people with obviously mobility issues who can't escape from fire, who haven't got any sort of fire detection, who are under sort of an informal care setting, that would make me sleep slightly easier at night, if that's okay. So if we could swap details, that'd be great, because I think we could really help each other out with this.
Thank you, Chair. Briefly, yeah, that's a good idea, very welcome, and Michael will reach out to yourself, and I'm just thinking out loud, and we had a really good attended carer conference back in January, got another one coming in October. Invite of you to be there, gets the message out as well.
That'd be perfect, if you don't mind. Yeah. Thanks so much. Thank you. Thanks, Chair.
Yeah, sorry, Gamal, I couldn't quite hear what you were just saying then.
Oh, sorry, Chair. I was just saying we had a very good carers conference, obviously in January, where a lot of partners were there, and we have another one we're planning for October, and it would be very helpful if colleagues were there, and Michael will reach out and we'll exchange details to loop you in on that, and it will help get the message out to carers.
I agree with that, and then also whether there's a scope for sort of information being given out through Mid-Mercia services as well. But just very quickly, Ian, is there anything that we could do via Derby Homes? I'm just thinking you don't really speak for Derby Homes, do you? Oh, sorry, James. I knew you were. Sorry, apologies. I knew it wasn't Ian, the Derby Homes.
Absolutely, something we can do. You know, at Derby Homes we have something called keeping in touch with our customers, and it's absolutely housing management. You know, who are in and out of the 13,500 properties, 20-odd thousand customers in those properties. We have intensive housing management officers who deal and work with customers who've got complexities in those houses. So it's absolutely our bag to be involved in this. And I say it'll be Carl Tring-Willis, who's the head of service for housing management, and I'm sure he'll be more than happy to link in.
Right, thank you. So I think what I'll do now is I'll draw the discussion to a close on this. How do we want to proceed, Gamal, in terms of finding nominated leads?
Well, Chair, I'm happy to take the conversation and discussion of this level of report into integrated care partnership, absolutely. I'd be interested in ICB colleagues' views around, is that where it needs to go to get champions, or are there any other views and suggestions within the ICB system who we need to connect with, and leaders who can champion and support taking this discussion forward, but also being part of the various groups that are emerging in order to take this discussion and the action plan forward, particularly those points in blue.
Yeah, thanks, Gamal. I'm clearly not as close to this as other colleagues, so my advice would be, first protocol is the ICP, to align it to the care strategy that we've adopted there. Then, when it's got that agreement that this is something that the NHS across Derby and Derbyshire is aligned to, we'd certainly then be interested in having that conversation about who across the system exactly is supporting this work and who the nominees would be. But that'd be the first step for me, Gamal. Thank you.
Thank you, Chair. That's really helpful. I'm not trying to put colleagues on the spot. As a really good example, I was going to say is, again, if I use the example that works very effectively, when we looked at children with special needs, there were colleagues within the clinical side of the system who are very familiar with this, but I appreciate we are talking about something that is much broader, but happy to take that offline with those colleagues to say, is that the model? Because we don't want to be approaching people that aren't the right people with the breadth of this, but thank you for that.
Well, thank you, and thank you, Chris, for that, and thanks for that clarification and suggestion as well. I'm just thinking as well, there's obviously the ICB, and they're always the ones put on the spot and sought after. What about Derby Homes? Does it make sense to have a name from Derby Homes, Gamal, and also the fire and rescue and the voluntary sector, and the hospital? I don't know who else we've got in the room. could people, it would make sense to have names from those organisations as well, wouldn't it, Gamal?
Yeah, absolutely, Chair. Just for ease, either email myself or Michael, or go via Lindsay, and we will pick those details up on loop-in. But those organisations make perfect sense.
Yeah, and I think we should stress, I mean, I think it'd be really good if people could all connect with Gamal and Michael, but it's not necessarily a commitment to, you know, a series of actual actions. Initially, we just need a name in order to start talking about this with all the organisations in the city, both voluntary and sort of in the public sector. So, thank you. So, do you need to add anything more on that, Gamal?
No, thank you, Chair. That's been helpful discussion.
Okay. Well, thanks ever so much for your discussion there, and it's really helpful. Thank you for your offers of help. And just to reiterate that the next Carers Forum meeting that we're having will be at the West Indian Community Centre on October the 23rd. Thank you very much. Okay, moving quickly on then to, so we've got an update from Robin Dewis here on the COVID inquiry, Module 1 report and recommendations. Thank you.
Thank you. And there was a specific question at the last board race for me, which was, if we had another pandemic, would we be better prepared now? And I'm going to try and weave some reflections on that just as I talk through, because as you can imagine, that isn't a straightforward answer. So there's a paper attached with a link to the brief report summary, which I think is really, really helpful. It's only 4 pages from the Module 1 of the inquiry, which is the first module to have reported. And importantly, this module is focused on resilience and preparedness of the United Kingdom. So it is that particular section of the inquiry that has been completed and reported. You'll see in the brief report that there's a number of other modules to come from either from a reporting, from the inquiry interviews, or from the collation of evidence. I'm aware that there's at least the last 3, I believe, that we're waiting to have those requests for evidence to go through as well. So this is a process that's going to be running over a number of probably years yet, and it's just to have that context to it. But the Module 1 report that we've had has highlighted some of the key issues where we weren't well prepared, and as an inquiry into national arrangements, clearly a lot of the things that have fallen out from that relate to national government, national systems, the emergency planning systems and processes that we have in place, the national strategies. So there's a number of areas that we will need to wait and see what the national response is. And just in the paper, there is a question for the board really on how the board would like to be updated on that national response. So there's 2 issues to be updated on. One is the outcomes of the upcoming modules as they come, and the other is how to be updated on the response of the government to the existing recommendations. So they're questions just to hold in your mind for the end. But just to run through the brief report that's here and some reflections on where we would be from some of the learning that has come. One of the key issues that was raised was that there was a national pandemic strategy. It was relatively old. It had been tested. There's a question as to whether the learning from those testing and exercises had been shared and acted on. But the key issue, particularly for me, is that the national plan related to influenza, and this related to our past experiences. We'd had a number of influenza pandemics, and that was very much what we were familiar with. And our response to an influenza pandemic is very different to our response to another infectious disease. And clearly we've had COVID. It could be another different type of infectious disease next time we have a pandemic. And I think the assurance is we will have another pandemic. The uncertainty is when that will come. We were aware it was 100 years since the last really significant pandemic, but we know that we'd had a number of more minor pandemics over that period of time. So from an influenza perspective, the planning is quite different in that we already had therapeutic interventions and vaccines that could be relatively rapidly considered and adapted and used to respond to the pandemic. Whereas with COVID, that was very much learning on the hoof and took some time to understand both the therapeutic interventions but also to develop the vaccination. And so the usual response to an influenza pandemic, which is to roll out the medical interventions as rapidly as possible, was not possible with the COVID pandemic. And I think there will be further learning from further modules, particularly when we come to the consideration of the test, trace and isolate programmes, as I think we learned a considerable amount during the passing of the pandemic around how we could actually do that much better than a national system that we had in place. There were lots of developments that needed to be made, lots of training that we needed to undertake, and information sharing that needed to take place to make that happen. But we could see, once we were into our local systems of test, trace and isolate, how effective they could be. And there's a question that will come up later on through the inquiry, generally around our national response, as to whether we need to look at different countries and their approaches. So some other countries very much had a response which was to ensure that individuals who were infected were rapidly identified and their contacts rapidly isolated in order to prevent the need for the national lockdown type measures that we underwent. And I think these are questions that will come up later in the inquiry and we don't have the answer to at the moment. And the other key question for me particularly is around the response for children and young people. And we know that there's a significant impact from that period of time on young people's education and mental health, social isolation. And recently we've been seeing around that cohort of young children starting in school over these coming weeks, and the impact of that isolation early on in their development. And I think we were in a position where those school closures were required because of our general approach to the spread of the infection. Had we taken a different approach, as I said, to test, trace and isolate, could we have done something differently from a school's perspective? I think they're the questions that do need to be considered. So I think there's not an answer today, and I think it will be some time as to how we've become better prepared. I think I'm confident that we do have learning that we have taken from the pandemic. I'm confident that those people who are still working in the system have learned a great deal, and were we to have another pandemic in the short term, we've got some knowledge and experience that we could draw on. The question for me is once we pass 10, 20, 30 years and those individuals who've learned so much from this experience are no longer working in the system, I certainly don't intend to be by that point, will we still remember these lessons? And so it's really, really key that the inquiry picks up from those things and gives us some clear guidance on how to lead the response in the future. So I think the key points are, this was the first module. It identified really clearly nationally where there are gaps, and there will need to be some work nationally to look at that. How would we like to be updated on that as a Health and Wellbeing Board? And the second part being there's a number of modules yet to come which will have some really important learning coming through with them. And again, how would we as a board like to be updated as those modules come through and the learning be shared from those? Very happy to take any questions on that.
Thank you, Robin. I mean, I do feel this is very important, and I think, when I talk to people more recently, I feel it is often it's a bit like a process, isn't it? Not like analogous to a bereavement process, but where there are different stages which people go through. And I find that the current stage, a lot of people I talk to, is they sort of normalise their lives again, but it's like this involuntary thoughts keep coming back about what they actually went through to cope with it at the time, and now there's more this space in a normalised environment to think about the impact it had on them and everybody else, and sort of wonder how on earth they did it in terms of the lockdowns and things. That's what I'm hearing from a lot of people I'm talking to anecdotally. So I know this is a serious inquiry, and so any thoughts or comments on Robin's questions and report? Councillor Kerr came up in first there.
Can I very much welcome your statement that this is part one, because I just feel there is so much more that is still to come out. One of the things that I'm concerned about is actually the ongoing situation. We've had a period over, I suppose, early summer into high summer where there have clearly been a lot of people, some of whom are still testing and said, yeah, I had COVID because I tested. And some may have had COVID, but we're not being encouraged to test. There doesn't seem to be any national statistics coming forward. We don't know whether the virus is evolving and whether there is something coming out of it that we might have been hitting us harder. And we seem to be not learning that need. I don't think other countries have been following it through. So that is one thing which I hope that the inquiry will look at, which is still the ongoing situation. And the other two ongoing situations that I hope we will be looking at are long COVID, which some people are still definitely suffering from, and also the impact, the individual impact of COVID, for which there seems to be some research saying that if you've had it, it impacts on your IQ, and that may be deteriorating as a population thing. Now, I don't think there's enough research done on that, but it's certainly something that's been flagged up, and that's not just for people who have had sort of brain fog associated with long COVID. It could be something else. We need to know, and we need to know what the impact is on our children and children who've had it, and whether that's going to be an ongoing issue. Loads of questions, so we need to continue to be updated as these modules come out and we get more information. Yes, please go on telling us. But the other point I think that we should be picking up regardless of that is any of the learning about resilience and the local resilience and what we can be doing for that, because that will be relevant not just for a pandemic, but it could be also useful for other things that are happening. So messages on local resilience, please feed them in, let's act on them, and ongoing learning from the inquiry, please. Thank you.
Thank you, Councillor Kerr. Yeah, once again, actually the whole afternoon actually, some very useful and helpful comments. Thank you. I agree with that. Councillor Hazelgrave.
Thank you, Chair. Obviously, part one of a lengthy process of deep dives into the whole thing and making sure we've got something. And I do share the same concerns about that generational thing that, okay, we might be conscious of it for 20 years, but what happens in year 21 is that knowledge, that deep knowledge kind of gone and evaporated, and people reinvent wrongly how to respond. So that should be built in, hopefully, to the findings of the inquiry. I know the recommendation is to consider how the board would like to be updated and assured regarding the national response to the recommendations. We might also consider the local response. And I would like to say here that I think it's a really important thing to put forward that the City Council, along with the voluntary sector and Derby Homes and other partners, and people who are just ad hoc volunteers, saw us through this together. And we shouldn't underestimate the importance of working in partnership with the voluntary sector and anyone who wants to put their shoulder to the wheel in anything like that. And it goes for any kind of emergency. So I would think we need to note that, not necessarily as part of the recommendations, but certainly note it in terms of our notes from this meeting, the record of the meeting. So I just thought I'd really emphasise that, because that will get us through whatever. Partnership and working in that way will always get us through, better or worse, depending on what the national picture is and the national guidance.
Yeah, thank you. Again, a really good point, Councillor Hazelgrave. Before I let Robin respond, are there any other comments? Chris, thank you.
Yeah, well, firstly, thank you for bringing the report. Incredibly helpful. And I'm probably with you, Robin, in the sense of information sharing as and when it comes, and keeping connected to the national recommendations and how they need to be implemented locally. I think the staging you've put together is right. It's too early to make changes yet because they're not fully known, but I think this information sharing is helpful. Although it wasn't a long time ago, lots has happened since, so it's helpful to have this reminder, isn't it? And Health and Wellbeing Board and the Health Protection Board, if I probably got the wording wrong, were really important during the response, so it does feel important that it's come back here. So thank you. Thanks, Chair.
Thank you. Yeah, and I just add my point, Robin. Well, I won't say too much, but I think you know, when we did this topic review into care homes during the pandemic a few years ago on the Health and the Scrutiny Board, I suppose you know, one of the things I said there is that the NHS in particular needs to know how to prepare for the unknown. And I think that's about a philosophy of education, and I would say that, wouldn't I? You know, and that's embedding it. That's not you being individual, that's the next generation of public health, or the next generation of medical professionals who are trained to think in a way that is just not about, you know, that is literally thinking, and part of any thinking, real thinking process is being that open to the unknown and the unknowable, and also what you don't know, of course. So I think that in the broadest terms is what is needed. I know that's very abstract, but I think without that, you're forever trying to ask questions that are premised on what you already know, which is obviously the definition of a question. But, you know, I think somehow or other just that openness to the unknown at the outset, rather than charging off in a military operation, assuming you know what's happening when you don't, even if it's an openness to what you can see is happening on the other side of the world, which I think we were blind to. But that's a judgment, which I'm sure the choir will look at. So thank you for bringing that report. So did you? So I think there's clearly people do want you to come back here with more reports on the recommendations. Do you want to come back on those comments?
Yes, thank you. So back to the data, back to the data comment. It is hugely frustrating for us now that we can't actually see a great deal of what's happening. We have a little bit of information related to inpatient care in the hospitals, so we do get an indication of when we're having upticks of cases. But it is incredibly challenging, and we couldn't continue to have the level of testing that we had, and it is that difficulty about how we then integrate that into the wider conversation around infectious diseases. And noted the comments around long COVID, and also noted that university colleagues here with us today and the work at the university around long COVID particularly that's ongoing there, which is really, really valuable. And then just as a proposal then, obviously the board are really keen to hear updates, so so perhaps there's an update that comes after each of the module reports, and less time, there's a significant amount of time passing. If we get to a year between, then we could have an update anyway on what's happening, but after each of the module reports I can bring something to update on where we're at.
Okay, thank you, Robin. I think that would be good. And then at some point, as I think Councillor Hasegrave or Councillor Kerr, or both, perhaps both alluded to, that perhaps we'll have those feedback, then we can have a deeper thought about how locally we can embed those system responses. I met with Kim Harper recently, and she won't mind me saying this, I'm sure, and talked about bringing the voluntary sector into the system more. And we talked about these Manchester Accords, which are part of the kind of cooperative model of governance or something, Paul, that we should be implementing. So I'm going to look at those sorts of things on a very strategic level. So that maybe that might feed into it as well. I don't know, I have to see. But anyway, I think people would want to hear more and are grateful for you bringing it today. Thank you. Okay, so I'm going to now move on to the Gamal again, and Alison are going to talk to us about updating the terms of reference and the membership of this board to reflect the fact that we've sort of incorporated the Child and Family Learners Board and also the Children and Young People's Plan. All that needs to be incorporated into our terms of reference. Thank you.
Thank you, Chair. As you've alluded to, this item really follows on from the report we had at our last Health and Wellbeing Board, where the board supported the dissolution of the Child and Family Learners Board and the absorption of kind of the key functions of that into this Health and Wellbeing Board. And Gamal and I agreed to go away and have a look at kind of those key functions and perhaps consideration of the membership that perhaps needed to be amended to incorporate within our terms of reference to make sure that those functions are adequately considered within this within this board. I'll just take you, I guess, very briefly into the terms of reference and kind of bring you to the points where we've kind of added those key elements. So in section 3 in purposes and functions, and at the bottom of page 2, highlighted there are the key elements in relation to the 3 core priorities of the Children and Young People's Plan and those Child and Family Learners Board priorities. We've kind of embedded those as part of the key functions in receiving ongoing updates of those 3 priorities, as was happening within the Child and Family Learners Board previously. And then if I take you on to kind of the suggested changes in or a kind of additional members, and that's in 4.2. I think the first of those is on page 3 and is Gamal himself. So, and then over on to page 4, I think our view was that actually probably the most relevant, rather than bringing over the entirety of the membership of the Child and Family Learners Board, and there was already some overlap in membership, that it probably made the most sense to bring through kind of the leads for those 3 priority areas around feeling safe, health equality, and kind of the life chances, and then finally kind of a voluntary sector representative covering kind of that children, young people's area. And we've had kind of a suggestion or a name put forward from, I think it was the YMCA, wasn't it, Gamal. So they're the kind of the changes that we've added into the terms of reference, with a view that this board kind of supports those changes, and that we kind of make that approval as to the council to take those forward. That's really all I wanted to say. I don't know if there was anything you wanted to add, Gamal.
Thank you, Alison. Councillor Kerr.
Thank you. I think you're making it very simple, which is something I like. But having got rid of the Child and Family Learners Board, does that phrase actually mean anything in terms of wider system bodies or national legislation? Or by continuing to embed that in the titles here under points S, T, U and V, for example, are we actually harking back to a history which could in the future be a bit confusing? And do we actually need that phrase maintained? I don't know enough about titles and things, because if it is only a historic thing, then I think we could further simplify it and reduce those phrasing, maybe need to include a word saying children in something else. And my other point relates to the purposes, which in terms of point I on page 2, is receive progress updates in relation to the children and family learners priorities. And again, if we don't have a board that is holding those as priorities, do we need that phrase? Aren't those standalone points enough And the third point of those, improve life chances our children and young people are supported to achieve and become work ready. I personally think that's too narrow. I don't want our children to be work ready and effectively economic cogs. I want them to be positive members of adult society or some phrase like that, and not just work ready. And I just wonder if we can change that, if these haven't got a bigger ownership somewhere else.
Thank you, Councillor Kerr. Shall I? I've got some other speakers. Shall I bring in who? I've got Councillor Heathergrave. And Gamal, did you want to respond?
Yeah, just briefly, Chair. So just to confirm, Children Families Learners Board isn't a term that needs to be used in a statutory sense. It's not a statutory board in that sense. It used to be some years ago, and that was one of the reasons why we were trying to incorporate children's agenda into a health and well-being agenda. In terms of the plan itself, that was agreed kind of 3 years ago, a couple of years ago. When we refresh those priorities, we will of course engage with this board and other owners in order to refine those. So nothing is set fixed in that statutory position.
Thank you, Gamal. I've got Councillor Heathergrave and then Chris.
Just on Councillor Kerr's comments about bullet point 3 on 4.3 and the wording about being work ready. I think if we get people work ready, eventually that is how the vast majority of people through their life will actually gain an income and feel they've got a place in the society. It's through work. But it doesn't mean to say people after schooling do have to go into work. If they can make their living in any other way that isn't work, let me know about it, by the way. By all means, proceed with that. And I see work there as being an academic. I see it in all sorts of fields where it's not something of a manual work type thing, or even the kind of work where you turn up every day. You could do it all at home. But I do think that wording should remain as it is, personally.
Thank you. I could give a really academic answer, actually, to this response. I might even do it, which is that "and" has two meanings, doesn't it? Is it something that joins or differentiates? And I think that whether you see it as a joining word here, or Paul, or a differentiating word, both you and Lucy can be satisfied by that wording. Because it is actually saying support, young people are supported to achieve, and then in addition to be work ready, or you could read it as achieve and thereby become work ready. So I think there's an ambivalence in the text. So I do appreciate your point, Councillor Kerr, very much, but what I think is that these are all incredibly laudable and good ambitions. I think that the health and wellbeing, and we're happy to incorporate them and assimilate them. I think the Health and Wellbeing Board has a really, really big remit already, and I'm not saying we shouldn't have that. I just think, realistically, we're not always going to achieve what we'd like to achieve, but we are at least a forum for discussing what needs to be achieved, and we must never give up on that. So I would suggest that as that grammatically that sentence can be read either way. I hope you don't mind, Councillor Kerr, if we just leave it as it is, because I think you can read it both ways.
Chair.
So, Councillor Wright. Sorry, I can't hear you.
Sorry, I switched it off. Yes, I think this notion of being work ready is quite contentious. By all means, educate young people, educate children, give them the empowerment they need, give them the skills and wherewithal to enter the labour market, for want of a better word. But I don't know why we need to put work in there at all. Thank you.
Well, I suppose I do empathise more here with Councillor Heathergrave, but I don't know. I'm
Chair, if I may.
floundering a bit now. Councillor Gamal, sorry.
Okay, thank you, Chair. Just to clarify, those three priorities are in the 2030 3-25 plan. 25 plan will be refreshed next year. When we refresh that, that's the opportunity to amend the wording or anything else that needs to be added in. The question isn't about amending the bullet points. It's about, of course, the discussion we're having now on the terms of reference, incorporating.
Thank you, Gamal. That's incredibly helpful. As I think that's right. Thank you for raising those points, councillors. They have been noted. I personally think that, given the grammatical ambivalence there, that everybody's points are covered. But I recognise what Councillor Wright is saying, and I think what I recommend then for the moment is that we retain that wording, which will be reviewed in time anyway. So if the board is happy with that. Alison, oh, sorry, Chris, yes. I'm definitely at the point in the afternoon where I need some tea. Sorry.
Well, let me not prolong that too long. A couple of things, if I may. So I fully support. The previous meeting agreed to disband the former group, and therefore we need to ensure continuity of the function. So it's important that it is absorbed, if that's the right word, into the terms of reference. So I thank you for what you've done. I think you've done the best job of transferring. Just a couple of things, though, if I may. I do have a view that it is also time to review the Health and Wellbeing Board terms of reference anyway. And I say that because of the link to the Integrated Care Partnership now and the conversation we've had today about just understanding who does what. And so I think that it's timely. I'm not saying for today, of course, but in time, I think that's helpful. So we could iron this out further from a terms of reference. Just the only one that's important for me personally is the first one around people feeling safe. Happy to take that on in sort of transferring, but we do have, don't we, the Children's Safeguarding Partnership, who would have a remit here. And then we've got the community safety partnerships that have remits in this race. So in time, I think we just need to think about the other partnerships that could adopt those areas. But thank you, Chair. Happy to support. Thank you.
Thank you, Chris. I think, that's another welcome comment. I think for the moment the point is to assimilate or absorb this formally into this board, and then you're right. We do have in the diary. It should be in your diaries. An afternoon. It should be in everybody's diary where we're looking at refreshing the health and wellbeing strategy, aren't we, Alison? So that's a good point to raise this actually with the board. I hope that everybody will have been sent an invitation. Is that correct, Alison?
I'm hoping so.
Yes.
Too.
So you should all have had an invitation to that, and I hope you will try and attend. But then I think also then it follows on from that, or is related to that, Chris, that we might look at the terms of reference, and I think that is something we should do. So with those caveats that have been raised, do we accept the recommendations for this report? We do. Yeah. Okay. Thank you very much. So now it's back over to you, Alison, for the Health and Wellbeing Forward Plan.
Yeah, final one, and it is very brief. Obviously, this just gives an overview of the items that have been put forward either through kind of actions and discussions at previous meetings or put forward otherwise in terms of items for the next meeting. And just to say, after this paper was published, we've had a request for an item on safe space to come to the next meeting, Chair. So I'll add that to the forward plan and we can kind of go through the agenda for next time, because it's looking quite, but potentially quite full. So just a consideration of whether we can cover all of those items or whether we need to potentially defer to future meetings. And just to note that the reports for those items are due by the 1st of November, and that all papers will be published on the 6th of November. And then overleaf, we've just got kind of the items currently on plan for the following meeting at the beginning of next year, which is slightly horrific to say that, but here we are.
Okay, thank you, Alison. And so, just as a reminder, it's the 24th, isn't it? The 24th of September, the development day. Is that correct? Yes. Yeah, the 24th of September in the afternoon. Do we have a venue for that yet?
Nearly, but I think we're in the. We may well have by now. When I came into this meeting, I think we've got a couple of likely, but as soon as we've got that confirmation, then we'll circulate that. But yeah, it's on the afternoon of the 24th, it's Tuesday, I believe, isn't it? The 24th of September for that session.
Right, thank you very much. Well, thank you for your attendance, everybody, and thank you for your contributions. That's really helpful, and we'll see you all hopefully on the 24th. Thank you.